What is the kidney? The kidney is two bean-shaped structures that every human being has located in the stomach. And usually it's towards the back of the stomach. There are two. The right one is below the liver. The left one is a bit higher but along the same side. Right above the kidney, we have two identical glands called the adrenal glands. So those are also glands that produce hormones. Now, the kidney's main function is filtration. If you take in any toxin, you take in any medication, anything the body feels that cannot be stored inside the body, the kidney is responsible for bringing it outside the body. So that's the main purpose of the kidney. Apart from filtering toxins, the kidney takes out all the excess fluids, all the excess water, all the excess materials that you take in which the body doesn't need. The kidney will take it and will filter it and take it outside the body. So the kidney plays a very vital role in us. Each person has a very important role to play as a kidney. Because of this, if there's any kidney problem, it causes a lot of issues. People who have one kidney are usually able to survive because the one kidney ends up increasing the number of functional units it has or the number of filters it has so that it will still be efficient and will still be able to carry out its function. How do we improve our kidney health? Most of the time, if we can regulate the amount of toxins that we take day in, day out, our kidney health will remain optimum. What do I mean by that? The foods which our body eats and is able to digest and use without much leftover is always optimal for us. For example, fruits and vegetables. When you're taking a lot of fruits and vegetables, all the extra that the body doesn't need is usually releases as raw phage in the stools, so the body doesn't need to store that. And most of the time, if there are any excess, apart from a few vitamins like vitamin A, which is stored in the liver, most vitamins and minerals found in fruits are not necessarily stored in the body, but all the excess that the body doesn't need is allowed to go. So this makes fruits and vegetables a very ideal form of diet for the body because it doesn't overburden the body. Alternatively, foods like fats and oils, usually when they are taken into the body has a lot of stores for fats and oils. If you look at our evolution structure, human beings have been in many situations where we have been under extreme cold, where we didn't have a lot of shelter to protect us from the cold. So the reason for the storage of fats was so that to prevent, the cold from reaching us or protect us and insulate us from the cold. However, by the grace of God and by technology and human ingenuity, currently we all have houses, we all have shelters, we have means, we have clothes, means of regulating our own body temperatures. And because of this, it is not necessarily important for you to continue taking in a lot of fats and oils in order to protect yourself from the cold. Carbohydrates. Carbohydrates can be transformed into fats and oil as well, depending on whether the body wants to use it immediately or not. Apart from being transformed into fats and oil, carbohydrates can be stored in the liver as glycogen. And when you are hungry or you need food or you need any energy boost and you are not eating, these stores will be called upon to supply the body with energy. Let's move on to why it's not so safe to take fats and oils. So the problem is that when you continue to take fats and oils, they continue to build up in your body. And as they continue to build up in your body and you're not using them and you continue to take more fats and oils, they begin to form, they begin to overrun the stores. And this is not very healthy for the body because the body has to continue to make room for these fats and oils and it's not being used. And it makes the body slow. It begins to coat the organs in the body and it begins to slow down the metabolism of the body. So it's very important that as much as possible you eat a lot of fruits and vegetables in your diet in order to make your metabolism very active and also to improve your general health. As you continue to eat every day and the body is continuing to store food every day, continue to store food in the liver, in the muscle and all that, ask yourself that when there are no stores, where does the rest of the stores go to? The body continues to create new stores for these products and we see it in abdominal obesity where our stomachs will start getting fatter. We see it in general obesity where our arms and our thighs and our legs start getting bigger and fatter and all that. And it may look aesthetically pleasing, very beautiful, very nice. However, if it continues to build up, it continues to build up in your arteries, continues to build up in your heart, your blood vessels, and this will lead you to have complications of diabetes, hypertension, high cholesterol, stroke, and many other medical conditions. All right, let's go back to our kidneys. There are a lot of things that can damage our kidneys, from the medications we take, to the food we eat, to not drinking enough water, to other medical conditions. Let's talk about one after the other. So I've described the food we eat and how it can affect our kidneys. Let's talk about the medications we take. Medications are usually cleared from the body through two main areas. Number one is through the liver, and then number two is through the kidney. The way that the liver clears medication is by breaking it down, transforming it to harmless products, and then taking it through the kidney, or transforming it into harmless products, and then the body can just do away with it. Usually, the kidney is the final way for excreting all substances that are harmful to the body. So if you take some medications like, let's say, brufen or paracetamol or diclo or anything, the kidney is the final place where these medications will have to be cleared from the body. And the problem is that sometimes these medications are toxic to the kidney. Taking it once or twice or thrice will not cause much of a problem for the kidney. But if you continuously abuse these medications, that's where the problem comes. The problem with the medications don't stay with just pain medications. It's pain medications, it's antibiotics, it's anti-malarial medications, it's anti-diabetic medications, and all forms of medications. Many medications have potential to cause kidney damage if they are not regulated well. But the important thing is that you have to make sure that you're not continually taking these medications, or else sometimes continually taking the medications is what will put you at risk of having kidney disease from these medications. So that's something we should know about the medications. The third thing that causes kidney damage, like I mentioned, is not drinking enough water. The kidney is supplied by blood, like all other organs in the body. And usually, when you don't drink enough water, it means that the amount of blood supply that is going to the kidney can be affected. Usually, in acute cases, in cases where you are vomiting profusely or you are having a lot of diarrhea, or maybe you go into labor, pregnancy, go into labor and you lose a lot of blood, there's an accident and you lose a lot of blood, or anything that causes you to lose a lot of blood or lose a lot of body fluids from your body, it could make your kidney very sensitive to the current situation where there's not enough blood to supply it, and this can cause the kidneys to shut down. So when you continue to hear that here drinking a lot of water is good enough for your kidneys, that's what it means. Drinking water helps to ensure that there's enough blood circulation which can get to the kidneys, keep the kidneys healthy, and keep the kidneys strong. So as much as possible, try to drink between 5 and 7 cups of water every single day. Between 2.5 liters and 3 liters of water every day. And that should be way more than enough to keep your kidneys sustainable. Okay, so if you have a kidney problem, what are you supposed to do? There are some things that can show if your kidney is not functioning. So the kidney's function is to clear toxins from the body, to clear water, excess water from the body, to clear excess acids from the body. So if you have a kidney problem, your water will start to accumulate in your body without being cleared. So you see it in your feet. Your feet will start to swell, your face will start to swell, especially in the night. So you wake up in the morning, you have a facial swelling, your body will start to swell. It can even come to your stomach. Where you say that your stomach is swelling, it can go to your lungs where it can give you breathing difficulties, coughing with some sputum. You cough, you produce sputum, you walk a bit, you are tired and all that. So usually the water overload is the first symptom or the first sign that we see that shows that your kidney is beginning to fail. Apart from the water systems, it could have an acid problem as well. If it cannot excrete acid, it can lead to metabolic changes where you feel slow, you feel like your energy is low and all that. That's because the acid level in your body is quite high. And then the toxins, usually the toxins that accumulate during kidney damage is something we call urea. Now, urea is a protein component, which is usually a byproduct of protein metabolism. So when you eat your chicken, you eat your fish, and it breaks down, it produces urea, and the urea is cleared by the kidneys without any problem. If you have a kidney problem, this urea can accumulate and the urea can move to your brain, the urea can move to your heart, the urea can move to your skin, the urea can move to your liver. What the urea does is that it slows you down. When it moves to your brain, it can give you confusion, it can even cause you to lose consciousness and all that. So urea in the brain is very dangerous. When it goes to your skin, it can give you itching. When it goes to your liver, it can slow you down. When it goes to your heart, it can give you a form of heart attack and all that. So usually toxins accumulating in kidney disease is seen in this manner. The positive news about toxins in kidney disease is that the toxins usually don't accumulate in the early stages of the kidney disease. So usually when doctors say that you have a kidney disease, we can quickly act to make sure that the toxins don't build up. You don't have any problem with, these side effects. All right. So these are the major signs we see if they are kidney disease. So what do doctors do? When you come to the hospital, the doctor will take your blood sample. He will most likely take your urine sample and do a scan of your stomach. So if you take a blood sample, you look at your kidney, check if any of the toxins are high or not. You look at your urine, look at if there are any proteins in your urine. If you have a kidney problem, the proteins will be passing through the kidney because the filter function of the kidney is no longer working like it's supposed to work. So the proteins will be passing through the kidney freely. It's almost like it's now a free range. It's like you have a garden with a fence, and then a part of the fence has broken. So usually one goat or two goats or one protein or two protein can pass through that space in the fence and then to be seen in the urine. And when you do a scan, usually in advanced stages of kidney disease, when you do a scan, you realize that the kidneys have begun to shrink, or they are starting to shrink, or the changes are coming in the kidney. So that's usually what doctors will see, and then they'll mention to you that you may have kidney disease. If you have kidney disease, it doesn't necessarily mean that we'll do dialysis for you, and it doesn't necessarily mean that we'll put you on kidney transplant. Usually, when you have kidney disease, the first thing doctors do is to stage it. We classify it between stages 1 to 2 to 3 to 4, all the way to 5. If you're in stage 1 or stage 2 or stage 3, the main goal of management is to make sure that you do not progress to stage 4 or stage 5. This is because most of the symptoms of kidney disease are seen more in stage 4 and stage 5. So the main goal is to prevent progression from stage 1 to stage 2, from stage 2 to stage 3, from stage 3 to stage 4, from stage 4 to stage 5, and then from getting into stage 5 finally. So usually, how do we do this? We find out what may be giving you the kidney disease in the first place. Is it that you have diabetes, hypertension, high cholesterol? Is it that these are the factors accumulating to cause the kidney disease? Is it that there are some medications that you are taking which are causing your kidney damage? Is it your diet? Is it anything related to the fact that you are stressing yourself? So we identify these problems and then we make sure that we stop the problems. If you put a stop on these problems, it helps to slow down the kidney damage. Let me give an example. If there is a pipe open and then there's a bucket overflowing, what do? Instead of fetching the water from the bucket away, you can just close the pipe. If you close the pipe, the water it will eventually stop flowing. So the main goal, first of all, is to make sure that we stop the kidney from that insult or that damage that is being caused by whatever disease or whatever infection or whatever food toxin is causing to the kidney. So that's the first step. Apart from this, we look at the complications. Is the kidney dysfunction giving you any complications? Maybe because of the kidney dysfunction, and you have a lot of fluids in your body. Because of the kidney dysfunction, you have a lot of toxins in your body. So the second step will be to make sure that we sort out the complications. We give you medications to make sure that if there's excess fluid, it comes down. We advise you to reduce your salt intake. Sometimes you reduce your water intake to make sure that you don't overload the kidney. Remember, the only time we ask you to reduce your water intake is when taking in water will directly mean that the kidneys cannot, bring the water out. So in those situations, we may ask you to limit your water so that you don't overburden the kidney. But this is only when the kidney has gone to a stage where it is going to be overburdened when you take in more water. So that's something you should note. So those are the few things that we will ask you to do and we'll ask you to note. And then afterwards, the next thing is to make sure that we prevent the kidney from progressing to the next stage. So what we do is I will be checking your kidneys every 2 or 3 months just to make sure that you are monitoring your kidney, be giving you advice on exercise, advice on diet, advice on keeping yourself active so that your kidney health will also be maintained. Finally, in case we realize your kidney health is still advancing to, let's say, stage 4 or stage 5, we may give you some medications to make sure that it controls the hormones and then the electrolytes and then the minerals in your body so that you don't have any side effects from the kidney declining. When the kidney gets to stage 5, usually that's when dialysis can be considered. Even with that one, not most doctors will wait till it gets a particular stage where the kidney has shown that obviously it cannot handle the pressure anymore. When it gets to that stage, what the dialysis machine does is it does the work of the kidney. When you connect the blood vessel to the dialysis machine, what it does is that it filters the blood of the toxins, it filters the blood of the acid and all the other factors which the kidney is supposed to do, and then it returns the blood back to the individual. The problem is that dialysis is not 100% efficient. No dialysis machine is as efficient as the kidneys. God is so wonderful in that He created our kidneys to be so effective. And currently, we don't have a dialysis machine that can do exact work of the kidney 100%. That's the unfortunate problem. So when dialysis is being done, the kidney function can still be ongoing gradually. But when it gets to a point where the dialysis machine is not able to remove enough toxins as we desire, we'll consider you for getting a kidney transplant. The problem with kidney transplants is that each person's kidney is coded to the person. Because of this, when you give a person's kidney to another person, sometimes the individual who has just received the transplant, his body can reject the kidney. So this makes transplant surgery, transplant medicine a very difficult field, especially for people who have kidney problems. When you are considered for transplant, we usually give you some medications to reduce your immune system so that your body will be unlikely to reject the transplant. Kidney health is very important. It's important for me, it's important for you, it's important for everyone. There are many things which cause kidney disease. They include medication, they include toxins, they include infections, they include cancers. There are so many. In fact, there are so many that it will be best to cover it in a different video. But the most important thing is that if you will drink a lot of water, if you take a diet that is rich in fruits and vegetables, if you make sure that you exercise regularly, if you control any hypertension, diabetes, or medical conditions that you have, you control it well, then you'll be doing your kidneys a very big favor, and very, very likely your kidney health will stay strong and will stay longer for a very long time. This is a Ghanaian doctor, Dr. Chimisi. I hope you enjoyed this video. Share and like this video with your friends.